You've been driving and your jaw is tight and it's sore and you got some headache. Let's go over some things that you can do. They're easy and you can do them while you're in the car. I recommend doing these at home first so that you can get comfortable with them, so that if you are behind the wheel, you can do them on a stop sign, a stoplight, or you can pull over to a rest area. You want to stay always in control of your vehicle. First, let's take a baseline. How is your jaw feeling? So first thing we want to do is just take stock. Are you tight up and through here? Is your face tight? Is your jaws, your neck, or your shoulders creeping up? What's going on? Where are your teeth sitting? So, just tap your teeth together. Were they already together? Were you clenching? Was there a little bit of space there? That's our freeway space. So feel how far apart your teeth are. Next, your tongue. Where is your tongue sitting? Is it at the roof of your mouth? Is it at the floor of your mouth? Is it off to one side? Is it pressing up against some of your teeth or maybe trying to squeeze through your teeth? Pay attention to that. Now let's see how we are opening our jaw. So just open it just as far as you feel comfortable going. Okay, just do it a couple of times, just see how it feels. And let's remember where our tongue was, how our teeth were resting, and what did it feel like when we opened and closed our jaw? And what about all the muscle tension? We're going to do some basic motions. With these motions, we want to make sure that we're never stressing, we're never pushing too hard, never pain, okay? So we want to go slow, easy, deliberate, and light. So as easy and comfortable and relaxed a motion as we can do. Keep this in mind throughout all of these motions. It is not a test. It is not a competition to see how far you can move things. If you can only move a few millimeters or a 32nd of an inch, and that's the only comfortable range you have, that is how far I want you to move. We are going to start with opening and closing our jaw just a little bit and see how that is. So we'll open and close. Okay, so when we open, there's a little pause at the end, and then we close, and then there's a pause, and then we open. We'll repeat this several times. Now, you may not be able to open as far as I am. You might just be opening like this. That's great. If that's where your comfort zone is, that's where I want you to live with it, okay? So do that motion. Feel for the smoothness. Is it smooth? Is it clicky? Is it gravelly? Is it sandy? Is there smooth parts? Because there's probably going to be some smooth parts. And then there's going to be some harder, difficult areas for you to move. So feel where those spots are that are easier, smoother, lighter. And we're going to concentrate on discovering ways to relax our jaw so that we can move smoother and easier as we open. So we'll open and close. Open, close. We can incorporate this with our breathing. So as we open, we'll breathe out. And we'll do that for the 4 seconds. And then we'll pause for 4 seconds. We'll close for 4 seconds. We'll hold it closed for 4 seconds, and then we'll open. So this is what I want you to be able to work towards. So we'll have our tongue in the appropriate place. So the N sound, roof of the mouth. Okay, that's the motion, but we're going to stop at either end. When we close, make sure you're just closing lightly. We're not clenching. We're not biting down. It's not a hard, firm close. It's a nice, light, just close. So open, breathing out. Perfect. So each motion is an independent motion. As you open and closed your jaw, did you notice if your head was rolling? So when we open and close our jaw, our head doesn't have to roll at all. It works as an independent motion. This is where puppeteers have problems because they open and close like this, when in fact, it's just the bottom jaw that's supposed to open. How we can figure out if this is happening is put our head against the headrest. And at home, when you're practicing this initially, you're laying down or you're sitting in a chair with your head supported, open your jaw and see if your head rolls. You'll feel some motion on the ground or on the headrest as you do this. Whether you do or you don't, what I want you to do is actually incorporate this. So again, we will breathe out as we open our jaw and we'll tilt our head back. Now this might be just too many things to do all at once. So don't worry about your breathing at this point. We can incorporate that later, but it's always open and breathe out. And we like to do it for 4 seconds with the pause for 4 seconds. So we will do the open and close and not worry about our breathing. Just do regular, comfortable breaths, however it feels for you. Open and roll your head purposefully. It's going to feel like your chin is moving a little bit away from your chest. We want to make sure as we open and close like this that the head is comfortable. We're not going too far, and the jaw is comfortable. Only open as far as you feel you can go comfortably and smooth without straining. After we've done this a few times, we can add in the breathing for 4 seconds, or let's just test and see how we're doing. So instead of rolling the head, we'll keep the head still. We'll open and close. Does it feel any different within our jaw? Is there a little bit more comfort, a little bit more smoothness to it? Does it feel like our tongue's in a different place? Does it feel like our chin is more central? These are the things I want you to pay attention to. If you're interested in helping people with their temporomandibular joint disorder, then go to the description, click on the link to dynamictherapies.com, and it will take you to my course offerings. We'll do some sideways motions now. So we're going to move from the center to the right, and then back, and then to the right, and then back to the midline, to our neutral. This is a slow, easy, gentle motion. It's making it as smooth and light and comfortable and relaxed as we can make it. That's what our goal is. So our teeth are just slightly apart, and we can move if you're having a hard time knowing which way your jaw is moving, because your proprioception, the way it feels, might be a little distorted. So putting your finger there can help you determine how your jaw is moving. So we'll move several times this way, and now we'll go the opposite direction. How does it feel? Does one side feel easier than the other? Most people have one side that's a little bit easier than the other. Does it feel like you have to open your mouth when you go to the side? Or do you keep it the same amount of space between the teeth? Is it jerky? Is it smooth? Can you smooth it out between each way? Are you holding your breath? Sometimes we hold our breath when we're doing these things, or we tense up. Are your shoulders scrunching up like this? You want to stay relaxed while we do this. That's the whole idea of this, okay? Staying relaxed, bring our nervous system down. Again, we can do breathing out as we go to the side, in as we come back to midline. Now swallow and take stock of how your face and your jaw feels. If you're feeling some pain or discomfort, it might be that you've done this too many repetitions. It might be that you're trying to force your jaw too far. A little bit is all we're asking you to do. We're going to do something very similar. We're going to have our mouth open just as far as we feel comfortable going. So that might just be a little bit. It might be a little bit more. It all depends on you. It's not a competition. We are seeing how far you can go comfortably. So we'll open our mouth a little bit and then we'll move our jaw to the side, coming back to midline. So we'll do one side and then we'll do the other. So swallow. Open your jaw to a comfortable amount. I'll keep my mouth open, my lips open so you can see the motion. So after we've done a few just to the right, we'll do a few just to the left. Well, we'll keep our mouth open. And then we'll do a few alternating back and forth. So from one side to the other. And then we'll close, we'll swallow, and we'll open and close our jaw. How are you feeling? How's the forehead, around the eyes, the face, the jaw, the neck, the shoulders, the abdomen? Are you feeling anything different through there? Swallow and open and close your jaw. See how that feels. Does it feel smoother? Are the smooth spots that you had a little bit smoother? That's what we're going for. We're working to decrease the sympathetic and increase our parasympathetic through our breathing and through our motions. We're introducing input into our nervous system in a healthy way, which will decrease a lot of the irritation for us. Practice this several times at home before you hit the open road. I would recommend that you do each motion 5 to 10 times and do this at least twice a week. If you could do it a few times more, that would be even better. Make a little sticky note, put it on your dashboard, and it's a good reminder of the series that we've just covered. If you want to know a little bit more about the temporomandibular joint, here's a video for you right here.